Okay, thank you, Amira. Today we have the pleasure of having Dr. Faisal Al-Sayegh from Kuwait, who has been actually heading some of the efforts for COVID there. Dr. Faisal Al-Sayegh graduated from Faculty of Medicine, Kuwait University in 1988. He did his postgraduate training in internal medicine, clinical hematology, and bone marrow transplantation at University of British Columbia, Canada, from 1990 till 1996. Dr. Al-Sayegh joined the Faculty of Medicine in Kuwait University in 1999 as an academic staff member in the Department of Medicine. He has contributed to many multi-center studies in the field of venous thromboembolism on the regional and international levels. He has also authored several original research papers, reviews, articles, and booklets related to epidemiology and prophylaxis of venous thromboembolism. Dr. Al-Sayegh earlier worked as a consultant hematologist for Al Salam International Hospital. His international experience includes various programs, contributions, and participation in different countries for diverse fields of study. His research interest reflects in his wide range of publications in various national and international journals. Currently, Dr. Al-Sayegh is an associate professor of medicine and head of clinical hematology unit of Mbarak Al-Kabir Teaching Hospital in Kuwait. Dr. Al-Sayegh is one of the founders and a member of the Gulf Thrombosis Collaboration. Welcome, Dr. Faisal.
Thank you, Ms. Hanadi, for this nice introduction. And I'm very
sorry about the pronunciation.
No, okay, it's fine. I know venous thromboembolism. Maybe if you read it for the first time, it's really hard to think about it. But anyway, in short, it's all about blood clots in the veins. So that's the easier version of it. But thank you for your invitation. I mean, I'm really happy to be among you today with this very prestigious group, and it really gives me the great pleasure to share with you the talk today. I know that we've been through this pandemic now for almost a year and a half, and we all have accumulated great amount of knowledge through what we have seen, read, experienced. Everyone, of course, we haven't moved around much, but everyone has been sitting tight where he is, reading, browsing the news, looking for hope or a light out of the tunnel. And I think because it's a virus, usually a highly contagious virus that spreads in the air, that's what makes this virus really difficult to eradicate or control from day one. If you remember the original SARS or the Middle East respiratory syndrome, or if you even the swine flu, they were contagious, but not as contagious as the SARS-CoV-2, or what they call it now, COVID-19. And that's what makes it really difficult to be contained, controlled, as well as control it from day one, and in order not to disturb our life. This virus has significantly disturbed the way we live, the way we look to, the way we are running our businesses. It has disturbed education, commerce, communication, travel, pleasure, everything. And you understand what I mean. So just, I don't want to, I know you have busy schedule. Let me just share with you a few slides that I have prepared. Let me go to my desktop, and do you see the first slide?
Yes.
Okay, so I just want to, all right. Now, okay, good. So the title that we agreed upon to discuss today is just going over some facts and myths about COVID-19. A lot of questions, a lot of rumors, a lot of misinformation flying around. We have groups that are known for a long, long time to fight against vaccination. They call themselves anti-vaxxers. They are well established groups in the United States and in the Western world, and of course because of the social media and of the open space that we are enjoying now, their ideas have actually infiltrated our community, and we are seeing now large groups of people believing in their ideology and calling against vaccination in general. Personally, I have relatives who have actually abstained from taking their youngsters for vaccination. They said this will kill them. And of course, it is really, really difficult to convince them the opposite. However, coming now to the COVID-19, of course, and because we are dealing with a virus, and viruses, such a contagious, quickly spreading virus, there is no hope to control it except with vaccination. And that's what the experience has told us historically, from the time when Edward Jenner in Britain discovered the first vaccine that was effective against smallpox in 1850s or 60s, something like that. It was more than 150 years ago. From that time, he experienced a resistance among the public. They who were thinking that Edward was actually coming up with quackery, with something that goes against God will, or they thought that he was going to convert people into animals because he was using a serum from cows that appeared as a small rash on their skin, and it was very effective to protect against smallpox. And we do hear the same principles, rumors that have the same principles running around us. And those people who actually have opposed Edward Jenner's vaccines have become stronger. They are using science against science, unfortunately. However, they are using twisted science. They twist the facts, and those twisted facts are very appealing to the public because they think that this is sense, but in fact, to scientists, what they say is totally nonsense. Anyway, let's just talk a little bit about the subject. In this presentation, there are a few points that I'm going to cover. The first one is to learn about the available COVID-19 vaccines, and then go quickly on the common myths related to those vaccines. We will discuss then the best places to find accurate information on COVID-19 pandemic as well as on the vaccines. And then at the end, we'll take the questions. I cannot start actually my presentation without taking the best example on how vaccines work in controlling viral spread. And what is the nastiest virus that we, in our memory, that we could remember? We could remember the polio vaccine, the smallpox vaccine, the measles, for example, and in Africa, you have the yellow fever, and you have other viruses that can spread really easily and kill millions of people. And they have indeed in the past. The polio is the biggest success story. And you know, I mean, maybe a lot of us have seen people running around who were actually affected by the polio virus, and they were left paralyzed in one or more limbs. But you know, up to 1988, there were 13 million cases reported at that time. But after that, the effort of the World Health Organization as well as of other health organizations, succeeded to contain and control the virus, and this effort has been successful in preventing millions of casualties to the virus, as well as millions of deaths and billions of savings to the economy. So unfortunately, nowadays, if you could see here that we have small active focus of polio running in mid-Asia between Afghanistan and Pakistan, because this is a tribal part of the world, and the vaccination effort and the vaccination workers have problem infiltrating tribes within the mountains and in remote areas, and often they get actually persecuted or even killed. And we have heard about a lot of those volunteers in the World Health Organization who were actually killed simply by the tribal men because they thought that these are coming to inject their children with harmful material. Unfortunately, that of course has led to the spread of deadly viruses like polio and smallpox. All right, now just to go quickly over those vaccines, I just want to show you a small clip just to make the idea easier on you. So I hope it's clear to everyone.
After we have been exposed to an infection, our immune system remembers the threat, in particular by producing antibodies. These are proteins that circulate in the blood and throughout the body. They quickly recognize and disable the invader upon contact, thereby preventing or minimizing illness. This is why we usually do not get sick with the same bug twice. We are immune. Vaccines mimic this process, encouraging the immune system to make antibodies without us having to go through the illness. Some of the leading SARS-CoV-2 vaccine candidates are mRNA vaccines, based on incorporating the genetic blueprint for the key spike protein on the virus surface into a formula that, when injected into humans, instructs our own cells to make the spike protein. In turn, the body then makes antibodies against the spike protein, and they protect us against viral infection. This strategy is faster than more traditional approaches, which often involve generating weakened or inactivated forms of a live virus, or making large amounts of the spike protein to determine whether they can prompt an antibody response. Once a potential vaccine is discovered, a number of checkpoints exist before it can be administered to people. First are preclinical tests, which involve experiments in a laboratory and with animals. Scientists must ensure the vaccine candidate is not only effective, but also safe. For example, an antibody response to an imperfect vaccine could, under extremely rare circumstances, end up increasing the danger of becoming infected. When the potential vaccine achieves the necessary preclinical results, clinical trials can begin in a small group of people. As the vaccine candidate advances, it is tested on increasing numbers of people, with scientists and doctors closely monitoring safety, efficacy, and dosing. Upon successful completion of clinical trials, the vaccine candidate must be reviewed and approved by regulatory agencies such as the FDA before large-scale manufacturing and distribution gets underway and the licensed vaccine is administered widely.
Okay, so now looking at this, going just again to go over the available vaccines and how do they work. We have the oldest type of vaccines, the vaccine type that was used by Edward Jenner 150 years ago, was by using live attenuated vaccines, which is using a live virus, but that virus is weak or has been weakened. This is the traditional old way, and there are still vaccines that use this method, like the shingles vaccine, the chickenpox, the BCG, etc. Now, the problem with this vaccine is that it is not suitable for people with weakened immune system, because if you give someone with weakened immune system a weak virus, this virus can regain its strength because there is no resistance by the immune system and will infect that person. So this is not a good vaccine to people with problem with their immune system. However, there are still a few vaccines that adopt this method. Now, the other type of vaccine is called the live killed whole part vaccine. This is a vaccine where they use a true virus, but this virus has been killed, but it does contain all of its component. The best example of that is the Sinopharm vaccine. The vaccine now is being used for COVID-19. The Sinopharm vaccine uses a whole killed virus. Now, the points with that vaccine is that actually it contains all the stimulants on its surface. We call them the antigens or the proteins on the surface of the vaccine to provoke the immune system. But again, this type of vaccine would need multiple booster doses to elevate its efficacy, especially in people who have problem with their immunity, that they may not mount or be able to make proper immunity against these type of viruses. And this would prompt the healthcare worker to give booster dose or doses over time to be sure that those people have achieved an acceptable level of immunity. The third type of vaccine manufacturing is actually a little bit more complicated. And those are the vaccines that use a code from the virus, and they insert that code into cells in the lab. Usually these are bacterial cells, and those bacterial cells will start making proteins of the virus. They don't make the whole virus, but they make part of it. And then they come and inject that protein into the patients. And the best example of that is the Novavax. Novavax vaccine uses this method, and actually it consists of the spike protein only. Now, the last one is the mRNA vaccine. The mRNA vaccine, and the best example of that is the Pfizer and Moderna vaccine. This is the newest technology where you start by picking up part of the viral genetic code that codes for the most important surface protein. And in the case of COVID-19, the most important COVID protein or surface protein in COVID is the spike protein or the S protein. So since we knew the code of the virus, the scientists isolated that code that codes for the spike protein. They did that actually through a certain advanced softwares, and from those softwares they were able to directly manufacture the genetic code as in the form of mRNA. mRNA is the messenger ribonucleic acid, or RNA. This is the genetic code of the protein. So they have two choices. You either incorporate that code into a lipid droplet or nanoparticle like in Moderna and Pfizer, or put it in another harmless virus like in Oxford, Sputnik, or Johnson & Johnson, where they used an adenovirus vector. So this is the newest technology. So because you are not interested in the whole virus to inject it into the patient to induce the immune system, you would only inject that part which codes for the important antigen or protein that would provoke the immune system. So by doing that, you are actually you are prompting your own cells to uncode the mRNA, to uncode it, makes the protein, the spike protein, and once it gets secreted into the blood, it will be recognized by your own immune cells, and then your immune system will start making antibodies, and they will learn how to recognize it in the future once the virus get into your blood. So that's the principle of the mRNA vaccine, and it has a lot of advantages. This can be done really very quickly because once you know the code of the protein, you can just feed it into the computer, and the computer will do the rest for you. Because with the now advanced technologies, through having fast and very intelligent computers combined with artificial intelligence, you can actually immediately manufacture the mRNA that you are interested in huge quantities, in comparison to making or killing viruses and giving them as a vaccine. So that's much easier and cheaper to make a mass production of our mRNA. You are only interested in a certain protein rather than injecting the whole virus into the recipient. It is safe, and it can quickly promote the production of the immune system. Of course, there are a lot of cons, there are a lot of problems with that. Most importantly, the storage and delivery of those vaccinations, especially you hear that Pfizer's vaccine requires to be in very low temperature, -70, in order to be transported and kept before it's being given. Now, what are the myths that are actually associated with COVID-19 pandemic and vaccination that are being circulating around? You hear, I'm sure that you hear them all. There are tons and tons of misinformation going around. And I'm going just to explore a few of them because I cannot, of course, go and debunk all of them. Now, one of the of those myths is that we hear that a lot, that only 1% of people would die from the pandemic. Why would you halt economies, people life, and make it a hostage to the pandemic? And it does not kill except maybe 1% of the people that it infects. And we hear that a lot. Of course, those people don't realize that 1% or 2%, according to the latest information, is too much. I mean, imagine if the world population is 8 billion, 1% of that is 80 million. So if you can afford that 80 to 160 million people would die through a certain time frame, so as we could just continue our life, that would not be totally acceptable to health authorities all over the world, or even to the political authorities. In addition, now, those figures of 1%, 1 or 2%, are reported only because all the governments and countries have adopted very strict closures and quarantine, as well as aggressive testing program, lockdowns. Imagine if you have your life open without implementing all these measures. Would you still expect that only 1 to 2% would die? No, of course. The mortality or death rate will go just like crazy, and we would have even more deaths in a lot of people, especially the more sick and the elderly. So that's not acceptable at all. So this myth is, I think, or the people who are circulating this type of argument, I would consider them as very cruel people. They just are careless. They don't care about the others. Now, the other myth is that the vaccines make you sick with COVID-19. Of course, this is wrong. The vaccines are not viruses. The vaccines actually, as I explained, either a protein, a dead virus, or a code that codes for one of the virus proteins. And there is no evidence that any of those vaccines actually would promote the formation of viruses or make you infected or make you vulnerable to be infected. We heard, for example, in Kuwait a couple of months ago, unfortunately, one of the famous actors received a vaccine, and a week later he was admitted and passed away quickly, admitted with COVID-19 and passed quickly. Unfortunately, that was I mean, rumors spread like crazy in the Gulf area, and they didn't know that. Unfortunately, the Allah yarhamah, the diseased person was already infected when he received his vaccine, and just like that, we could, because you couldn't predict how people would do with their infections, he deteriorated very quickly and could not respond to all the treatment that was offered to him in the intensive care unit, and he passed away. But of course, the anti-vaxxers and people who are spreading rumors took that incident as a proof that vaccine killed him. So that's how the stories are made. The other one is that as soon as the shot is in my arm, I'm protected from COVID. No, that's very important to understand, that as soon as you get the jab or the shot, you are not protected. You have to wait to complete your vaccination. 2 vaccines at least, enough time after the second vaccine, at least 2 weeks, that would make you protected. And again, even if you have received the vaccine, even if you have waited enough after the second dose, you are most likely to be resistant to infection. However, you should bear in your mind that there are also cases that have been infected. They are rare, but you should always be aware, and you should always protect yourself even after receiving the second vaccine. After most of your community actually receive the vaccine, then you can relax a little bit. It is similar to telling you that the safety belt in your car protects you against death, but that doesn't mean that there are few people actually who died after, despite the fact that they were putting the safety belt on. So yes, the vaccine reduces your chance of dying. It protects you almost 100%, but you should be aware that there is a chance, especially in those people with chronic diseases who take drugs that may impair their immune system, and especially the elderly. Those are the people that we should still practice vigilance, protection, and should also not be relaxed in terms of spreading the virus to them. Now, there are other few rumors that are going around, like that people were talking about that the vaccine may tamper with your own DNA. Of course, this is not true, because the genetic code of the vaccine does not penetrate or incorporate itself into your own DNA. It only gets translated, and then it will just vanish, because there are enzymes into the cells that would just make it disappear and totally from your system. There are rumors that say that vaccine came out so quickly. We hear that a lot, that they rush the vaccine. Vaccines usually take years. They are true when in that point. However, you should understand that now the science and technology has advanced so much that you can quickly come up with a solution. For example, the coronavirus vaccine, I'm talking here about the Pfizer BioNTech vaccine, was ready from March of last year, and they started the clinical trials in April. Of course, because of the demand on an effective vaccine, and because the government paid generously to research, and because you have a lot of intelligent, well-skilled people gathered in one place to facilitate the discovery of an effective vaccine, and again, because of the cutting on the bureaucracy of the governments, of the review authorities, we had that being done in relatively short period of time. But that does not mean that there is a compromise on the safety or efficacy of the vaccine. The vaccines took all the stages of experiments on animals as well as on humans before they were approved or given the emergency approval label to be used or given to the public. One more myth is that we cannot believe something that is new. And of course, that's another myth that people think that it is not new. But now, from the world real data, you can see countries. One of the speakers here said that Britain recorded 0 cases, which is a proof that United Kingdom, because of their aggressive vaccination campaign, and according to the World Meter, which counts the number of vaccines given, Britain today has vaccinated more than 90% of its people. And that's why they are achieving 0 cases. The same is true for other countries, for example, Israel, if you see the data from them, the United States, if you go by state in the United States, the states that have achieved the highest number of vaccinations are the states with the lowest number of reported cases and the least numbers of deaths from COVID. So the numbers don't lie. We have the numbers there. Even here in Kuwait now, we have actually vaccinated 55% of the people here in Kuwait. And for the first time, the mortality or death rate in the ICUs have dropped from 10 or 15 per day to yesterday was 1. And the number of ICU occupancy dropped from 300 or 250. Yesterday it was 140. So it is showing on the number of admissions. And well, we are talking to our colleagues and they say, yes, now almost all the people now in hospital with COVID-19 are those who have not received their vaccine, unfortunately, but hopefully within the next 2 or 3 months, most of our population will get it. Now, there are people who would say that I'm going to wait. We saw those people. They say, okay, I'm fine. I'm not against the vaccination, but I'm going to wait a little bit to see if there are any risks on the long term. Of course, everyone is free to think however they want to think or decide whether to take the vaccine or not. But this is something, this is like a selfish way of thinking, because you should think about the people around you, especially the old people, those with chronic diseases, those who are taking drugs that are affecting their immune system. You might be a carrier of the virus to them. If you are healthy, young, with no diseases, and you decide not to vaccinate now, you will act as a carrier because you might be asymptomatic carrier or a carrier without a symptom and infect those vulnerable people. So this type of behavior should be changed. Some people have spread the news that the vaccine contains aborted cells from fetuses. Of course, this is totally wrong. This is totally not true. The current vaccines contain no cells, no tissues from humans or aborted fetuses. And finally, we heard rumors that the vaccine contains pork, animal, or some products like gelatin. And of course, from being in Muslim countries, there are people who have reservation on eating food with gelatin. And of course, this is totally not true because all the products that are, or all the vaccines that are available contain no pork or no gelatinous products. Okay. Okay, so now some people actually, people who had the infection does not mean that they should not get the vaccine, because it has happened that previously infected people were infected again with the new variants, because this virus keep changing its clothes and keep tricking our immune system. And the only way to strengthen our immunity, even if we were infected before, is by getting the vaccine. So getting the vaccine with minimize significantly the risk of getting it again. Okay, where we do get our information from? There are a lot of services, a lot of news outlets, and a lot of rumors, and the social media is playing a major part in our daily life, and we are carrying smartphones full of social media software like the WhatsApp, Twitter, Facebook, etc. So do you get your information from healthcare professional or from your friends, family members who are rumoring about the COVID-19, or getting their news from uncertified sources and spreading those rumors? So of course, you should always ask the healthcare professionals, especially those who are working in the field and dealing with the COVID-19. Do you get your information from Instagram or from the WhatsApp? Here, it is very common in the Gulf. We said WhatsApp, mother's WhatsApp, or from WhatsApp al-Ummahat, because mothers are well known to spread uh, messages that come to them, to the family member, and most of those are not true. Or the CDC. This is an example of a certified health institution, and we all have our own certified scientific organizations or sectors in our countries. Of course, we should get the news from the certified scientific body that are informing us on COVID-19 based on studies, true studies, and from true data. Of course, another comparison, World Health Organization or Facebook, of course, the World Health Organization. I'm not here trying to discredit Facebook or Instagram, because there are people who are actually publishing true information, but most of the false and misinformation comes from these outlets as well. Now, there are a lot of news media flying around in our TV, radio, as well as we are receiving news on our mobiles from news agencies. Of course, most of those news agencies are trying to announce the true news from published studies. However, also you have to be careful from yellow newspapers or tabloid outlets. There are tabloid magazines that are spreading rumors, as well as be sure that information comes from a news station that either adopt the extreme right or the extreme left. They may sometimes skew the news on their own favor to get political benefit out of that. So again, the news outlets are more or less reliable, but sometimes they may manipulate the news to in their own favor. So you have to be careful. Okay, these are my two last slides because I know I took a lot of from your time. Just trying to see what's happening in Bahrain, because I know a lot of people in Bahrain are concerned in the last few weeks about a big surge in number of cases. Although Bahrain was the best example to us about how they controlled the pandemic from its start last year, and you were doing really well till the beginning of this year, when the cases started to surge, and it has surged significantly in the last 4 to 6 weeks, with an increased number of people dying from the pandemic. Unfortunately, I have no inside information from the health care authorities in Bahrain. They are the proper people to tell you why this happened. But from an outsider, I would probably apply the general rules on why do pandemic, or why do those sort of pandemics spread at any time. Given the fact that COVID-19 has actually went into mutation and we have a new variants, I would assume that probably because Bahrain is more or less an open country, most likely those aggressive variants have managed to penetrate Bahrain and probably responsible for this surge of cases. Number two, probably a lot of big sector of people who receive the vaccination received probably one dose, I would assume, and that's why their immunity has not become optimal to resist reinfection or infection. In addition to our own social behavior, especially here in the Arab world, once we have sometimes see that the situation is back to almost normal life, we restart our gatherings, weddings, etc. And these type of activities are the times when the COVID starts spreading again. This is well known and well documented. However, you may have more information on the situation in Bahrain. Maybe we can talk about that when I finish. Now, I quoted that from the Ministry of Health Bahrain, just to show you that the deaths mostly occur in people who were not vaccinated. And to me, 5% vaccinated people died is too high. And I would probably wonder, why did they die? Didn't they achieved full immunity from their vaccination? Or did they have an underlying serious illnesses like cancer? Or they were very old to handle any reinfection? Anything is possible, but probably as I told you, these are all causes for people who were vaccinated to be infected or die from COVID-19. The answer is with the Bahraini health authorities. And I think they will probably publish that recently. So by that, I finish my presentation. Thank you very much for your attention. And I'm sorry that I took more than what I'm supposed to. And I think the floor is open for any question.
Great. Thank you so much, Dr. Faisal. We do have a few questions. The first question is from Shafqat Mimon. He says, for people who received Sinopharm, should the booster shot be only Sinopharm, or can it be an mRNA shot?
Well, I am biased. I mean, my answer will be biased. I would advocate a different platform. Now, for a person who received a vaccine of a certain platform, like Sinopharm, which uses a dead virus, I would go with either Oxford or Pfizer or Moderna, which used a different platform. And studies have shown that mixing vaccines produces very strong immunity. So I would probably answer that if you have received the Sinopharm 2 doses and you are offered a 3rd dose, you can go for Pfizer or Oxford or Moderna. Yeah.
Okay, thank you. We also, we have a question from past President Khalid Turk. He wants to know, I think this is relevant to Bahrain as well. Since Bahrain, I think the percentage of vaccinated people is something like 50%, and then 20% already finished their 1st dose, from what I know. He says, why are the number of deaths increasing even after vaccination?
I have no idea. The best person to be asked would be a personnel of a health authority here in Bahrain, because they have an inside information on the reason why there is a surge, despite the fact that half of the people in Bahrain received at least 1 dose. But again, as I mentioned, that by receiving 1 dose, you have not completed or you have not achieved a full immunity status. In addition, if you have a new variant, like the South African or the Indian variant, Even the vaccines that were given may not be 100% protective against these variants if you have not received a second dose. And even if you have received a second dose, there is a small chance of being sick and a smaller chance of being very sick and being admitted to the hospital. We've seen people here in Kuwait, after one dose of Oxford, for example, we have a shortage of Oxford, and people now are complaining in Kuwait because it's been now more than 4 months since their first dose, and we have not yet received the complementary doses to continue the second dose to those who received the first one. But there are people who had their first dose and were infected without any symptom or with minimal symptoms. And rarely you find someone with one dose and have severe symptoms, and even more rare to die from that. But if you have not been vaccinated, the chances are much higher.
Thank you. We have one more question. Dr. Harb Al-Umari, he's asking, why would we use mRNA vaccines that need calibration with each mutation, while Sinopharm, utilizing envelope protein, is not affected by mutations?
Now, for this, let's go for the mRNA vaccine. The mRNA vaccine is the latest or the fourth generation vaccination that is using a very specific targeted treatment or stimulant to induce specific antibody against a specific protein. In medicine, this is very important because if you inject the whole virus, on the surface of the virus, there are multiple proteins, and each one of those proteins would provoke a different antibody. However, if you have one protein, your immune system will be focused on that protein and would mount a higher level of antibody. So mRNA vaccines have been proven to induce very high antibody level and antibodies against the most important protein of the COVID-19 virus, which is the S or spike protein. That protein is needed to have the virus entering into the cells. So if you could block it, you would block the entry of the virus into the cell and eventually killing the virus. Whereas if you use a whole dead virus with all its proteins, now the immune system will make still antibodies, but probably it would be, I'm not, don't take me for granted, but that's the general feeling that those antibodies would probably be less than what you would achieve with mRNA vaccine. And number two, if you have variants, now you can easily modify your mRNA, and within few weeks, you can come up with a new vaccine against those more deadly or virulent variants. Whereas if you are using a dead vaccine, a dead virus, you will take much longer time to prepare a vaccine for those variants. Variants do infect those people who were already infected previously with the older version. Now, the older version of the virus, which emerged from China, is still circulating, but now that version now is not very harmful because our collective immune system has known that and has achieved some sort of immunity against it. What is emerging now and what is dangerous are those new variants. And now lately we heard about the Thai/Egyptian variant, which is again very, very virulent. It can spread even 20 times more than the Indian and South African variant. Imagine that, how quickly that can spread and cause disease. So to chase those variants, number one, the mRNA vaccine have been proven to be more effective and still on the more recent studies to be effective against the current newly emerged variants. And you can easily come up with a new vaccine that can be manufactured and distributed very quickly within few weeks to control new variants. A thing that you cannot do with dead viruses. I know it's a big subject, it's highly debatable, but I hope that I explained it in a short or simple way that everyone can understand my answer.
Thank you,
Nadi.
Dr. Faisal. We have Dr.
Sorry,
Ghafar Al-Amran also who wants to ask a question.
Yes.
Dr.
Sorry.
Faisal. Dr. Faisal, أولاً, first of all, thank you very much for a very enlightening presentation. I really like it. And I share with you all your ideas, and I agree with all what you have said. But I just want to ask you, I have two issues to ask. One, I have taken the Pfizer vaccine, and they told us, we're not sure about that, but that's why I want to ask you, that they said that maybe after I took the second one and I have waited and I am still using the double mask and protecting myself, but they say maybe after 6 months, I need to go for another booster for Pfizer. First of all, I want to know whether this is a fact or do I just keep what I have already on me. The second issue, Dr. Faisal, is in Bahrain, we are facing campaigns against vaccination, this is the biggest problem we are facing in Bahrain. There are some people who are educated, between the quote educated, they believe that the vaccine is not important. They are anti-vaccine. They are even campaigning for people in Bahrain, don't go for the vaccine, which is really causing our crisis. I really feel that if people are not ready to help each other, like you have mentioned in your presentation, and go for the vaccine so that we get above 70% or 80% the community gets vaccinated, we'll never get out of this. So do you share this with me, or how we can convince these people to be wise enough to go and get vaccinated? Thank you.
Okay, thank you very much. For answering your first question, still there is no general consensus whether we need a third dose or not of any of the vaccines. However, local authorities in each country has its own plan depending on their local situation. And now experts in the world have predicted that a third dose most likely will be needed 6 months to 1 year from the second dose. The additional dose probably will be manufactured to accommodate the new variants. So you will have additional immunity in addition to the immunity that you already have with the current vaccine against the new variants. So if there is a new vaccine that you are going to get 6 months from now, it will probably be covering the new emerged variants like the British, the Brazilian, the South African, the Indian, etc. However, there are no recommendations on the worldwide arena. The CDC, the British health regulators, and others have not spoken publicly, or they have not come up with plans on the third dose. We do hear here and there rumors, or we do read articles about the third dose. Personally, I think there is a third dose. When, I don't know. But if it comes, it will cover the new variants. The second part, I share with you your concerns. I agree with you 100% on the intense propaganda that has been waged. Actually, it is a war by those anti-vaxxers. To me, we talked about that in my account on Twitter. I've been attacked by them. Of course, I mean, I'm used to that because personally, I think anyone who is adopting this position is like someone who is going against his own people and country at the time of war. We are at a time of war. We are fighting an invisible enemy. We are fighting an enemy that is killing people, that is killing our own beloved ones, that is destroying our local economies, that is actually stopping the progress of education. And because we do have, and because we have no way how to get around it, we have used initially those measures, which the health measures, which is of course disinfection, wearing masks, etc. And now we do have the light at the end of the tunnel in the form of the vaccine, which has proven to be effective based on the studies that actually were published, proving its efficacy, and based on the worldwide data. Now, we are now almost 6 months from starting of the vaccination campaign, and we are seeing the effect of that in the countries that have adopted very aggressive vaccination campaign. So there is no doubt that vaccine work. And in my mind, there is no doubt that those who are spreading rumors are running against their own societies. I'm not advocating that we should punish them or push the authorities to persecute them. I believe in freedom of speech, but not the freedom of speech that would hamper any effort to protect our own people from getting the infection and die. When it comes to public health, there is no free speech. There is science, and there are experts who are actually tell you what to do. It's like when you want to fly. Do you argue with the mechanical engineer who is maintaining the airplane engine, or the pilot who is flying your flight about you are doing that right or wrong? No, because we are not expert in that. We trust them. We trust their experience. We trust their education, and take us safely and fly us to our destination without any incident. So it's the same here for medicine and public health. We should trust the healthcare professionals. We should trust our local health providers. And we should not trust those who are going around against people health and promoting misinformation. I have no solution to that. In Kuwait here, unfortunately, we have done nothing. I think there are countries like Saudi Arabia and Emirates. If you are talking against what the local health authorities are promoting, you will be caught responsible. And that's why maybe in Bahrain is like Kuwait, people are talking without feeling the responsibility of the consequences of what they say. But I don't know what is the solution of that. But for eventually people will be convinced. I don't care about those who are spreading rumors. I'm caring about my own family members, friends, my community, the people who are naive and they believe anything that they hear. We want to reach those people. And I think if we reach them, then we are going to protect our communities.
Dr. Faisal,
thank you very much.
Thank you so much. I think we have, this topic is clearly a very interesting topic for everyone. And there's so many more questions, but we are running out of time. So what I suggest is that all the questions that haven't been answered yet, what we can do is we can send them to you, and perhaps at a later time.
Or we can do as another Zoom meeting at another time and talk and answer the questions. And maybe by that time we will have more answers. We have newer situations on the ground where we can discuss and talk, and hopefully we can celebrate by that time, or maybe come to you in Bahrain and meet up with you. And
absolutely, hopefully once everyone's vaccinated.
You know, my son is studying in Bahrain in the RCS. He's here now in Kuwait, but he will be back. And I always fly to Bahrain because my son is there. And even before that, I have a lot of friends in Bahrain. But I'll be delighted, of course, to meet with you and talk about many subjects, not only Corona, but we can talk about science, philosophy, art, anything.
We thank you so much for your time. I'm going to pass this on to President Amira.
Thank you very much, Nadi. Dr. Faisal, thank you very much for the valuable, interesting presentation and correcting all our information. Actually, it was great to know from a professional like you what is the correct info, especially that I know that everyone is scared, and because we are scared, we are listening to here and there and taking the rumors for granted. Thank you so much for correcting all this info, and definitely would like to meet with you